What's going on, everybody? It is your boy Tim, back with another video, and I finally found some bodies of water in Arizona. I'm here at, I think it's called Papago Park. A lot of cool stuff, but the thing that really got me was there's like, I don't know if I call them lakes, ponds maybe. There's some ponds. So your boy's getting to see some water, so I'm walking around, I'm exploring, I'm enjoying myself. There's some cool rock formations out here too. Pretty cool place. But I wanted to turn the camera on and talk about a topic that is probably the most requested topic on my channel over the past few months. And that topic is how to live without healthcare or without healthcare benefits. A lot of people message me, they hit me up and they say, Tim, we like what you're saying about like living free and quitting your job and maybe doing seasonal work or gig work or working for myself. But if I quit my job, I won't have health insurance. I won't have benefits. And like, what am I supposed to do then? So I just want to say, folks, not to toot my own horn or to pat myself on the back too hard, but I think if anybody can make this video, it's me. I think I am uniquely qualified to speak on this subject because for the 20 plus years I've been an adult, legally an adult, I've only had health insurance maybe 5-6 of them years. Your boy don't be having health insurance much. So I think I'm the man to talk when it comes to how to survive and thrive without health insurance. Okay, and the first thing I want to say is I know how hard it is when you have insurance and you're thinking about getting rid of it or you think you're going to lose it. I actually, the past 3-4 years had health insurance and I just recently got rid of it because they like quadrupled or more the price. And I was like, I ain't doing it. But the week or so before I really made the final decision to get rid of it, I was going through it. I'm like, man, what if this happens? What if this happens? You start thinking of all these maladies and illnesses and diseases and broken bones that could descend upon you. Even if for the last 5 years you've been healthy, that health insurance is kind of like peace of mind. And as soon as you think about getting rid of it, you start thinking you're going to get sick. First and foremost, I want to say, just because you get rid of healthcare doesn't mean you're going to get sick immediately. It's not like the universe just has like a ball of sickness waiting, and then as soon as you get rid of healthcare, it throws it at you. No. So there is the possibility that you could get rid of your healthcare and stay just as healthy as you are now. I will be honest, though, it is a gamble. It is a gamble. Like I said, health insurance, it is peace of mind. It is peace of mind, and there is the possibility that once you get rid of it, something could happen that if you'd had the health insurance, it would have been easier for you to take care of. Less money out your pocket. That's something you definitely have to think about. And I just want to say in this video, folks, I'm giving my opinions, I'm talking, but this is quite possibly one of the most personal matters out there. It's your health, it's your life. So definitely, you have to make this decision on your own. You, your family, your spouse, your kids, whatever. But this don't think that anything I say has to go for you. This is just me. Okay? Now, just because you don't have health insurance doesn't mean you don't have access to like health care. Let's put that out there. You still have access to pretty much the same level of health care. It's just probably going to cost you more. But I want to share real quick with you some ways that I used to get health care when I didn't have health insurance that, saved me money. They weren't really the traditional ways. One of the major things I used were urgent care centers. And these things are popping up everywhere these days. When I was using them, there was usually like 1 or 2 in a town. Now there's 12 to 15. They're popping up everywhere. And an urgent care center is basically somewhere where you can go, you don't really need an appointment, you pay between like $100 and $200, and either a doctor, a physician's assistant, a nurse practitioner, somebody who knows what they're doing can help you. And this is usually basic stuff like you need antibiotics or you got something else kind of basic going on. Maybe you broke a minor bone. And this keeps you from having to go to a much more expensive doctor. Now, I just want to say, do your research. Don't just trust the first urgent care center you come across. Just like everything in life, I've been to some urgent care centers where they really, really went out of their way to help me. And I've been to some where I left feeling like they just robbed your boy for that $150. I said, what did I get for my money? So do your research, find some good ones. I've had some that really I've had some waive some of the fees. Okay, I've had some of them, I said, I came in, I had the $150. They wanted to do some other test or something. And I was like, how much is that? Always ask how much the extra stuff is the urgent care place. If they say, oh, I want to do so-and-so, how much is that? And I've had them say, well, each test is going to be so much. And I was like, I don't have that. And they're like, you know what? Don't worry about it. So you can go to an urgent care center and get your basic healthcare needs taken care of. Another one, and this is a really good one, and this is one I had to find out on my own. I had to do my research, and I realized and I found out that there are lots of local county, city, sometimes state programs that are put in place for usually lower income earners to get healthcare on like a sliding scale, fee-based kind of basis. Okay, so basically you go in there, you show them your check stubs, and depending on how much money you make, that determines how much like you pay to be able to see a doctor. A lot of these are clinics and other little places, but they're not really like talked about. I had to do my research. I found one in Florida that really came in handy for me, and I was making decent money at the time. And I was like, I don't know if I'm gonna qualify for this. I went in there, showed them my check stubs, and my copay was $15 every time I went. Boy, I milked that one for years. The one I went to was really good. She actually solved some stuff for me that I'd been to 2-3 other doctors and they couldn't solve. I'd been to the urgent care many times, the same issue. No one can figure it out. She solved it for me. So do your research. You can Google whatever town, city, county you're in, sliding scale healthcare, reduced cost healthcare. A lot of times there will be clinics in hospitals that are part of these programs. Sometimes if you're in like a college town, they will have students who are planning on becoming nurses or RNs or doctors, and they will work in some of these places, and you can get healthcare for cheaper because the students are learning. And that's not always going to say that it's like worse healthcare or not as good, because there's usually like someone, an administrator or an actual doctor there, like looking, going over, their diagnosis. Okay. So definitely look into that. Like I said, that is something I used for many years, and it helped me out so much because like that became like my primary care physician. I just went to them, paid $15. I was good to go. And I think they even had like prescription like help. Okay. Actually, I was at the urgent care the other day. I thought I was getting an earache. I was going out of town. I ran down to the urgent care and I was like, Doc, like hit me with some antibiotics before this earache comes in. He was like, your ears are fine, but I'll still write you a prescription. If it acts up when you're out of town, just go get it filled and it should knock it out. But when I went to check out, and I think this one was like $99. When I went to check out, the lady handed me a card and she was like, oh, use this when you go to get your prescription. It'll be discounted. And I was like, yeah, whatever. You always see those cards at the doctor's office. Long story short, I used it and it knocked my prescription down. I think it knocked like $30 off my prescription. So that's something else you can look into. If you see any of those prescription cards, try them out. Ask wherever you go. Ask, hey, do you have any like something that can help me with a prescription? I know there's places like Publix that certain antibiotics and stuff they'll give you for like free. So definitely do your research. Don't just think it's either you got healthcare or you don't. There are lots of resources, especially if you don't make a lot of money. The more broke you are, the better these resources will be. Not to mention, folks, most of us live in countries where if you go to the emergency room, they have to treat you. Okay? If you go to the emergency room in the United States of America and it's something they can treat in the emergency room, they have to treat you. Now, they're going to hit you with, probably a huge bill that you have to decide whether or not you're going to pay it. I will say if you don't pay it, it does drop off your credit in about 5 to 7 years. Just putting that out there. But they will treat you. So don't think that like if you get sick and you have to go to the ER or something like that, they're just going to let you lay there and bleed out. No. Now, if it's a major illness that, you're going to have lots of, just different medicines and consultations or a specialist or something like that, that's different. But the ER has to like treat you. And this is something I think on too when I was trying to get my mindset right to get rid of my insurance. Out of the 8 billion people on this planet, I promise you a good 4 billion don't even have access to something like an emergency room. Most of the people on this planet probably consider themselves very fortunate if there's a doctor in the village or in the region or in the province. And a lot of times those doctors might have aspirin, maybe some antibiotics and some bandages. The fact that we live in a country or countries, a lot of us, where there's 100 doctors and places we can go to get healthcare in this country, in our city, and the fact that there's a hospital with the emergency room or several hospitals with emergency rooms where they have to treat us, puts us in like the top 1% as far as healthcare. So I know it may seem like, especially if you work at like a good job and everybody has healthcare and everyone has healthcare, it could seem crazy to not have it. But I know a ton of people who don't have it, and they're okay. They're okay. I haven't had it since the beginning of this year. I'm okay. But there's tons of alternatives. Don't think, if you decide that you want to just like do something different and quit your job, that you're going to be dead in 2 years because you don't have healthcare. That's not the case, especially in a country like the United States of America. We are so blessed. So blessed. So just, I know it can be rough. I know it can be hard. But you just have to realize that if the things you want to do in this life are pointing you in a direction where maybe for a year or two you won't have healthcare coverage, especially if you're young. If you're in your 40s, okay, let's have this conversation. If you're in your 20s, what are we talking about? If you're in your 20s, what are we talking about? Quit that job. Once again, these are just my opinions. If you're in your 20s and you're in your prime health, quit that job. I didn't have, I don't know if I had healthcare in my 20s at all, ever. I had a lot of ER visits. A lot of them were from alcohol poisoning and things of that nature. And they all fell off my credit. We'll say that. But like I said, if you're a little older, you're my age, your body has already started to maybe break down a little, let's have this conversation. But just know, I know like for me, I would much rather have gambled and took the risk I take not having healthcare than stayed at like soul-sucking jobs because of the healthcare. Because in the end, I probably would have ended up sicker, even with the healthcare, just because of what like those jobs were doing to me. I wouldn't have been happy. I would almost rather be happy and kind of sicker, or don't have the same access to like getting help when I get sick, but be happier and living the life I want to live than to be at like a job I hate and being miserable and stressed out and worried. But, when I get really, really stressed out and worried, I can go to the doctor and get some pills. But that's just me. But I wanted to make this video and let people know, there are so many options out there. One of the things we do not do enough of in this life is research. But I promise you, if you research affordable healthcare, if you research like different clinics and different programs in your area, you will probably come across something that will help you out if you decide to go the not healthcare route. So don't be afraid. I know it takes some time to wrap your head around it. I'm not even gonna lie, it can be scary. There's even some times now, say I'm way out on a trail somewhere and I slip or maybe almost fall down, and I'm like, Tim, you can't afford to break that leg. You can the lifestyle I'm living, I cannot afford to break no legs, you know what I mean? So it does pop up in your head, but that's 5% of the time. 95% of the time, I don't even think about healthcare. I'm just living my life. If I'm healthy, I don't think about being sick. If I'm sick, I just figure out ways to get taken care of. You're smart enough to figure it out if you decide that's what you want to do. But I promise you, living your life, going after your dreams, not only will it help keep you healthy, but I feel like in any situation, any scenario, whatever we're talking about, that's always the best route to take. Anyway, I'm Tim. Thanks for watching. If you want some more information on some of this stuff, please DM me, comment box below, hit me up, hit me on my social medias, and I'll try to give you more information if you need some, or if you just want to say hi, hit me up. Anyway, I'm going to go enjoy the rest of this, what is now turning into a very hot Arizona day. But I'm loving it. I'm enjoying myself. I'll talk to y'all later.